I'm Lauren, I'm 28 years old, and Dr. Robertson removed a malignant melanoma from my back. I went to Dr. Robertson because my mom had noticed, basically for a couple of years, that the mole was kind of dark and was oddly shaped, so she had asked me to come and get it checked. So I came here and she's noticed and said that Dr. Robertson can take a look at it. So he did and said that it needed to be biopsied. I really didn't want to think that I had malignant melanoma, but after Dr. Robertson told me that I needed to have it biopsied, I went home and did more research and noticed that, that the mole wasn't symmetrical and the borders were a little bit weird, and I started feeling it and noticed that the texture had changed. But I also felt that I was young and, that this really couldn't happen to me. But, when I got the phone call, it was in fact malignant melanoma. You might as well go get checked, because if it is nothing, you don't have really anything to lose other than the 20 or 30 minutes that you took to go to the doctor's office. But if it is something, you basically, if it's melanoma, have a lot to lose if you waited too late, because while melanoma is kind of a slow growing at first, if it gets in you, it's in you. Dr. Robertson has removed 3 other lesions off of me besides the melanoma. I come back periodically for checks where he takes off other spots that I just don't like or he doesn't like. I came to Dr. Robertson to have the lesion removed because Dr. Robertson has done sinus surgeries on me, and I trust his judgment. He is a great plastic surgeon, and I feel as though he could completely remove the lesion. Now that the melanoma has been removed, I feel like that there's always still going to be some sort of worry, because I had a melanoma, and I think that that puts me at a greater risk to have another one. Even Dr. Robertson has said that the patient themselves usually find melanoma. So I think that we ourselves as patients have to keep a check on our own bodies and know, was this placed there last year, or has it changed? Are the borders symmetrical? And I think that's what we can do as patients.